All the services that an individual might get in the hospital setting or at a regular mental health, we provide those services in the community. So it's basically like the hospital on wheels. We go and visit people where they are in the community and help integrate them into the community, and our goal is to keep them out of the hospital.
I have a mental health professional and a substance abuse specialist, and they see individuals weekly. My peer support specialists, they link them to resources and provide peer support as needed.
As a certified peer support specialist, I come from the lived experience perspective where I have a mental diagnosis myself. When folks have like just somebody that they can relate with and kind of understands those symptoms, it makes an instant bond, and we're really able to help some of these folks. One thing about mental illness is there's such a stigma associated with it, and sometimes the stigma itself from society can actually be worse than the disease itself. And not only is there stigma from society, but we stigmatize ourselves.
PACT have some individuals that have problems with taking their medications every day due to confusion. So I myself or staff would take that individual their medications every day.
We have a lot of clients that, as typical, they don't want to take their medicine, but I can come and say, hey, that I take medicine, and I can play as a role model for them. We're all responsible for our mental health, and if that means we have to take medicine just like you take medicine for diabetes or anything, that people should be okay with that. Seeing people advance in their recovery is the best part of my job. I mean, some of our folks, that's one of their goals, is they want employment. They don't want to just do nothing. They want what we want. They want to have a fulfilling life and a productive life.
My supported employment specialist, she assists them with going back into the workforce and furthering their educations, such as getting their GED, because a lot of them don't have their GED. And we have some that attended college, stopped college, but plan to go back.
One thing, a lot of our folks, they don't have transportation, so they don't have a way to follow through with their appointments at the main center, or they don't have a way to go get their medicine, and we provide those services. They don't have to worry about not having transportation because we're going to come to your house. Even if you don't have a house, we're going to come to wherever you are located.
A lot of our clients that we service, we are their only support system. PACT is keeping them out of the hospital, keeping them in the community, and assisting them with maintaining their stability.
Some folks just need that little bit of extra assistance to maintain their independent living. So without PACT, people would be cycling in and out of the hospital much more frequently. And I found that after a couple of years of receiving PACT services, people really start to be cutting down those hospital visits. And if they do have to go in the hospital, their hospital visit tends to be shorter in duration, which also saves money in the long run.